Good afternoon, everybody, and thank you for joining us for today's webinar, looking at the COVID vaccine in younger people, so in particular sort of 18 to 25, 30. I know that Wales are playing, so it's a great honour that you've joined us today, and hopefully we'll be keeping one eye on things as well. My name is Dr. Alauddin. I'm a GP in Cardiff. I'm stepping in today for Dr. Qasim Ramzan, who's unfortunately become a little bit unwell, so we wish him the swiftest of recoveries. So today we'll be looking at the COVID vaccine, and in particular, as we said, looking at more how it would affect the younger people and any questions that anyone may have with regards to either vaccines that we've got, well, or any three of the vaccines we've got, so the Moderna, the Pfizer, or the AstraZeneca vaccines. Now, if you do have any questions, please feel free to type them into the Facebook chat box comments, and our team will help us pass it on to the panel so we can try and get through all your questions. We've got a fabulous panel here today. I'm going to ask them all to introduce themselves. I'm going to start with the ladies first. So Dr. Bnar, if you wouldn't mind.
Hi, good afternoon, everyone. My name is Bnar Talabani. I'm a hospital doctor in kidney and transplant medicine. I'm also a scientist in immunology, which is science and study of the immune system. I've had both doses of my COVID vaccine, as have all my family. And I was very excited to have my COVID vaccine. And I'm really delighted to be here today. I'm not affiliated with any drug companies or I don't in any way benefit from promoting the COVID vaccine, just want to help arm people with accurate information.
Thank you. Dr. Amara Naseem.
Hi, my name is Dr. Amara Naseem. I'm one of the GP working here locally in Cardiff area. And I also had my 2 COVID vaccines, and I'm really glad to be here. Hopefully I will be able to help answer any of your queries or concerns.
Thank you. Professor Kelechi.
Hello, everyone. I'm Kelechi Nnoaham, and I'm currently Director of Public Health for Rt Hon Eluned University Health Board. I'm a medical doctor by background. My background is in infectious diseases, but I'm also currently an honorary professor in the School of Medicine in Cardiff University. I have had my first dose of the vaccine, and I'm eagerly waiting for my second dose. I have absolutely no financial benefit from participating in today's session, nor in any of my work related to the vaccination. Thank you.
Thank you. And Dr. Mohammed Alhadj Ali.
Good evening, everyone. My name is Mohammed Alhadj Ali. I'm a lecturer in diabetes endocrinology at Cardiff University School of Medicine. I'm also a clinical researcher with a focus on immunotherapy for type 1 diabetes. So immunotherapy, I'm talking about vaccinations and immunology system actually is the focus of my academic work. I'm also a champion for School of Medicine in public engagement. I've done lots of these webinars, and also I have no benefit at all of doing these engagements, apart of just like the benefit for our society and for our community. I got my 2 doses of COVID-19 vaccine, and I'm very much excited to talk about it today and share the knowledge I have with all of you today.
Thank you very much. And in addition to our wonderful panel, we have a very special guest joining us today, the Health and Social Services Minister for the Welsh Government, Rt Hon Eluned Morgan, who is also the Baroness Morgan of Ely. So thank you very much, Health Minister, for taking your time to join us on this busy weekend. I know you've got 101 different things to do. If I'd kindly ask you just to say a few words just to open the session, and I understand then you have a lot of other things to do, then you may have to take your leave.
Well, thanks very much. And first of all, thanks for the opportunity to come and share this platform with such eminent people who really know their stuff. So I feel very humbled to be with you. I am privileged to be the Health Minister in Wales at a time when we have had a phenomenal success when it comes to the rollout of the vaccine in Wales. We now have 88% of the population who've had their first dose. I was lucky enough to have my second dose earlier last week, and that was AstraZeneca. Very pleased to have the opportunity to take that opportunity. My son came back from university yesterday, and the first thing I did today was to take him straight down to the vaccination centre. So I do think it's really important, particularly for young people, to take the opportunity to be vaccinated, because you know, we want people to go out and to have the opportunity to mix. It's something that we're all desperate to get back to, and the sooner we can get as many people in the population vaccinated, the better and the easier it will be for us to get back to a different level of normality. I think it's going to be a while before we get back to the normal that we used to know. I'd first of all like to thank the NHS staff and the people who volunteers around Wales who've done a terrific job. And it is important not just that you get the first jab, but also the second jab, especially now we've got this new Delta variant, which we know spreads far more quickly than even the Kent variant, which spread quicker than the first variant. So, you know, it's speeding up all the time. And what we know is that you're far less likely to be hospitalized if you receive both of the doses. And that's really the message I'm sure we all want to give today, is that we need you to be vaccinated, because it won't just protect you, but it will protect the people you love. And you know, we live in a community, we live in families, and we have a responsibility to them as well as to us. And I'm sure you will bear that in mind when you're making your decisions. We've been very clear in Welsh Government that we want equality in Wales, and we want everybody to take up the opportunity of really taking this vaccine. And we're slightly concerned that there is a differential between people from different communities. And so there is a differential in particular with people from Black ethnic, minority ethnic communities compared to white communities. And we need everybody to take up this opportunity. And so our plea today is really, let's get everyone to the same level. We're particularly concerned. We had an equalities report last week that was published, and it suggested that there seems to be a particular problem amongst Black and African people from African origin and from the Afro-Caribbean communities between the ages of about 30 and 40. So that is a particular group that we need to focus on. And so, you know, if you're not in that group, please just galvanize people in that group if you have the opportunity, because we're just desperate to get people protected in Wales. You know, people have suffered so much during this pandemic. People have died in their thousands. And you never know if it's going to impact on you and how it's going to impact on you. And it affects people in so many different ways. So don't take the risk, take the opportunity of really taking up that vaccine, and let's close that gap between white people and people from different ethnic communities. So I hope, and I'm sure that the experts on this call will be able to give you chapter and verse about why the vaccine is safe and why you shouldn't be nervous about taking the opportunity. So diolch yn fawr iawn i chi, and thank you very much for allowing me to join you today.
Thank you very much, Health Minister. And as the Health Minister alluded, it was about trying to make sure that people feel confident in taking the vaccine. And the idea behind these webinars is not to say that you have to have it, but it's to give you all the correct information so you make the best informed choice. And any questions you may have, anything you're concerned about, please feel free to ask. And that's why we're here. There's no wrong or incorrect or silly questions. If you have that question, I can guarantee there's hundreds of other people who have the same question. So please do feel free to ask anything you feel is worrying you or concerning you. And by the end of this, hopefully you'll be feeling confident enough to make a decision about whether vaccine is the best thing for you. And well, in our opinion, we do think that, but it's about giving you the right information so you can make that decision for yourself as well. So let's make a short start. I think Dr. Bnar has got a very short presentation, and I think a lot of people are presentationed out in terms of doing things online and so on and so forth. So it'll be quite short, so please bear with us. And after that, any questions you have, we'll try and field them. So I'll pass you over to Dr. Bnar.
Thank you, Emaad. Can you please let me share my screen?
You should
Thank
be
you.
able to.
Yep, got it. Thanks very much. Okay, so yeah, it's going to be a very short presentation, I promise. Thank you for joining us on the webinar today. Now, you will have heard a lot about these vaccines. I'm going to give you a bit of a summary about the vaccines that are available for use in the UK. So first of all, why do we vaccinate? Well, vaccines help to teach our immune system about an infection, in this case a virus called COVID, that we may or may not have come into contact before, so that our immune system can up its defenses and provide us the best protection that it can, so that if we do come into contact with it, we are ready to fight it off and not become ill with it. It does this by producing something called B cells, which help to produce antibodies that neutralize the virus, and T cells, which have multiple roles, but one of the roles is that to act as the immune system's memory. So even if the antibodies are no longer circulating in our body, say years down the line, the T cell still does the job of remembering what the virus is, so it can help to protect us. Vaccines work by protecting the individual and reducing the risk significantly of us actually getting the virus. But even for those of us who do get the virus after the vaccine, the risk of us being hospitalized with it or dying from it is negligible to non-existent. These vaccines are in particular are very, very effective, but they also work because they help to reduce the spread of the virus to others around us. So what's herd immunity? You will have heard the phrase herd immunity around in the public, on news, etc. quite a lot. But herd immunity is achieved when we vaccinate the majority of the population so that the whole population is immune from a virus. And what that means is, if you have a look at here, this infographic here, the blue or the green people are vaccinated and the orange people are not vaccinated. So when you have only a few people who are vaccinated, the virus can rip through a population and lots of people can get ill and therefore die. But if you have the majority of the population vaccinated, you've achieved herd immunity. And that means that the virus does not have the chance to pass and spread through the population. And if one person has it, they might spread it to one or two, but it won't spread beyond that because the people around them form a barrier and prevent it spreading further because they're vaccinated. Herd immunity is important because it helps to protect people who can't, for medical reasons, have the vaccines. It helps to protect those who have weaker immune systems, so can't derive the full benefit of a vaccine. And herd immunity is also important because it reduces the risk of spread of the virus, it actually also reduces the risk of new variants from occurring. And so it brings the virus under control. Now, somebody who's young, in fact, young people in general, I know we talk a lot about hospitalization and death, and that's important because lots of people have died from this virus, but it's also been disruptive in lots of other ways. And young people have borne the brunt of this virus economically and socially. So vaccines are the safest way for us to achieve herd immunity and to be able to overcome the pandemic so that you can go back to traveling again and seeing family and friends and enjoying university and all the things you're supposed to be doing when you're young and healthy and fit. But sadly, the pandemic has really disrupted all of that. So what's actually in the vaccine? So the Oxford AstraZeneca vaccine, if you're under the age of 40 and you're going for your first vaccine, you're not going to be offered this Oxford AstraZeneca vaccine. But the advice is if you've had your first dose, you can go on to have your second dose, and that's fine. That's completely safe. So what's in it? It's got an inactive virus called an adenovirus that normally causes a common cold, but because it's inactive, it can't do anything to us. That's got a little bit of information from the COVID virus, again, not the whole thing, so we can't get ill from it at all. And that's carried in a little bit of chemical alcohol, sugar, salt, water, tiny amounts, and some preservatives, the same that we have in food, so that we can keep it in the fridge. The Pfizer and the Moderna vaccines are what will be offered to those under the age of 40 in the UK. They're very, very, very safe, and we have lots of really good data to back this up because hundreds of millions of people around the world have had these vaccines. They work by carrying something called an mRNA, which acts as the blueprint, which is the blueprint for the information of what COVID is, that our immune system reads and goes, okay, that's what COVID is. I'm going to go and prepare my defenses to protect you. That mRNA information is carried in a fat droplet that's grown in the lab. It's not derived from animals or anything like that, salt, water, and sugar. And the Moderna vaccine is only different because it also carries preservatives, again, similar to what we have in food, so that we can keep it in fridge longer. There are no toxic chemicals or harmful chemicals or anything like that in these vaccines. They're all vegan, halal, permissible to Muslims, and kosher. And the really important thing is that the contents of all the vaccines are broken down within a few weeks, less than a few weeks of having them, and they're totally, completely removed from the body. And that's why we talk about side effects. Side effects always present within this short time frame because a vaccine has left the body by then. And that's it from me. Thank you very much. Please follow us on social media. I'm going to hand over back to Emaad and we will start the questions. Let me just stop sharing my screen. Okay.
Thank you, Bnar. So yeah, as Bnar mentioned, if you haven't already, you can follow us on social media for more information. So join us on Twitter, Facebook, or on Instagram at Muslim Doctors Cymru, and we post regular content about vaccines and COVID and the benefits of all these things. So it's just a reliable source of information if you do have any queries or questions. So we do have questions coming in. We've had a few questions beforehand and some questions from Facebook. So we'll start on the first question we've had. So the first question we've got is, why should someone who's young and healthy have the vaccine? So why should someone who's young and healthy have the vaccine? It's a common question that we do face. And if I ask Dr. Amara, can you come in and address this question for us?
Thank you, Dr. Emaad. So I think first of all, it's really important to know what are the vaccines, as Dr. Bnar rightly said. So we need to first of all establish that vaccines are the preventative substances. So these are the preventative measures that one has to take in order for a specific vaccine in order to prevent us from a specific disease or illness. Whereas the medications are the curative substances. So most of the medications are taken in order to cure us from a certain disease or illness, or in order to compare the symptoms which are caused by certain disease or illness. So first, once we have established this, that the vaccines are the preventative measures, then now coming back to questions why it is important for healthy individuals, or especially youngsters, to take the vaccine. So there are two main reasons. First of all, in order to prevent themselves, and second, in order to protect the community around them. As Dr. Bnar has already established and told us that the youngsters, they are less likely to get seriously affected by COVID-19 infection. But on the other hand, we have seen certain cases where they have become seriously ill and have hospitalized, or in some unfortunate cases have died because of COVID-19 infections. By taking vaccine, we can significantly reduce the chances of getting hospitalization due to the COVID-19 infection. Second of all, though young people, they are at less risk of getting seriously ill, but they are at high risk of getting the long COVID or the prolonged symptoms due to COVID-19 infection. As a result of this, what happens is that it disrupts their normal or day-to-day living. It affects their studies, their jobs, their finances, and in turn, it affects the whole of the community, in the economy of the community. So again, taking vaccine will significantly reduce the chances of having this long-term or COVID symptoms or long-term COVID syndrome. Now, coming back to community, the youngsters, they can carry the virus within themselves and without showing any symptoms or showing just mild symptoms. But as long as they are carrying viruses within themselves, they can spread the viruses to the people around them. So still they can infect their loved ones and the people around them who care about them. So again, taking vaccine can reduce the risk of spreading this virus to the people around them. And the most important thing, as Dr. Bnar said, is going back to normality. We would all love to go back to normality, and we can achieve this by achieving the herd immunity, which again, Dr. Bnar has rightly said, when most of the high percentage of the population, they will get the vaccine, making the whole of the population immune to this virus, so reducing the spread of this virus. And by doing this, we will also be able to protect the vulnerable in our communities. So by us taking vaccine, we will be able to protect the vulnerable people who for some reason, because of some certain health conditions, are not able to take the vaccine. So these are the main things that why the healthy and the youngsters should take the vaccine.
Yeah, I think one of the hardest things as doctors I found is that we can't visit our elderly parents because of putting them at risk. There's a very important point to make there, Dr. Amara, about protecting others and doing what we can to get back to some normality. One thing that has been in the news quite a lot recently is this talk about variants. As we've heard about the Delta variant, and before this we had the Kent variant. So how do these variants come about, and do the vaccines protect against the variants? And if I can ask Dr. Mohammed Alhadj Ali to come in on this one.
Thank you, Emaad. Talking about variants actually is talking about an essential part of the life of viruses. So each time any virus spreads around, there will be a chance actually to have a little bit of change in the structure of that virus. And this is what we call it like mutation or variation. So up till now, since the start of the pandemic of COVID-19, we had more than 4,000 mutations or changes to the structure of COVID-19 or coronavirus. Now, what's the implication of that one? So some of these changes may lead to new strains or new variants, which can be like quicker to spread around. And in other cases, they could be associated as well with some changes in the symptoms, how they appear and how they spread around in the community and in the society. However, what I have to say that these changes always detected by health authorities, and we will be always told about like the new variants and whether they are quicker or not, and whether the symptoms related to these new variants are different from the symptoms which been spread around before. Now, the good news about that one is the vaccination available for our community, all excellent in tackling these variants, and they're able as well to protect from these new variants. If I talk about the Delta variant in particular here, because it's now a hot topic in the news about the Delta variant. So this is quicker than the Alpha one or the Kent one, which was quicker than the variants before. And this variant, the Delta variant, will appear with different symptoms, which are pretty much similar to the common cold symptoms. So looking at the patients, those who've been admitted to hospital between January to June or mid-June 2021, over 6 months period. So these patients who contracted the Delta variant, the majority of them, the vast majority of them, not being vaccinated with COVID-19. And the vaccine, actually, those who got 2 doses of COVID-19 vaccine, they got protection of 90% not to be admitted to hospital with COVID-19. And that's really great. And this is like an evidence here from the data available between our hands that those who will get a couple of doses of COVID-19 vaccine, these people will be very much protected against the new variants. So up till now, we say that all vaccinations very much ready and very much effective in tackling the variants we have now in our community, in our society. So please, when you are offered the vaccination, think always about 2 doses, get the complete protection, the complete immunity against COVID-19, and that will protect you and prevent you against any new variants available now in our community.
Yeah, I think what you're saying is very important, Dr. Alhadj Ali. Just a little bit of an example. We've got a care home with our GP practice. There's been an outbreak there of Delta variant. And as some of you may know, they do bi-weekly testing at the care homes. Of the people who have been tested positive, the ones who have had 2 vaccines are not showing any symptoms. The only one person who's showing symptoms is a staff worker who's only had 1 dose of the vaccine. So it just shows you how important and how well these vaccines are working against this particular variant. So it'll be very important. We've got a question from Facebook on the chat from Rusna Begum. So the question is, some people with cholesterol or heart conditions have a worry about blood clots regarding AstraZeneca. Please, can you say something about that worry? So I'll open that to panel. Dr. Bnar, if you want to come in?
Yeah, I can cover that. So the way in which, first of all, blood clots with the AstraZeneca vaccine are incredibly rare. They're very, very rare. And because we now know a lot more about them, having them doesn't mean that people die. Fewer and fewer people are dying compared to right at the beginning when we first saw them, because we know how to treat them. The way in which the blood clots happen as a result of this vaccine is not the same way that other blood clots happen, causing heart problems, lung problems, leg clotting, as normally happens in the population, which is actually quite common. So 1 in 1,000 people in the population will have clots in their legs, lungs, head, for lots of different reasons, including smoking and obesity and the pill. But the way that these blood clots happen are actually slightly different. So if you're someone who's got risk factors for clots, normally, that doesn't necessarily mean that you have a risk factor for a clot with the AstraZeneca vaccine. However, if it is something you're worried about, please go and speak to your GP, because I don't see that anyone will say to you, you can't have a different vaccine to reassure you and to just minimize that risk, even if it is there. But because it's a completely different way that that clot occurs, your risk isn't increased if you already have a risk for clots.
Yeah, thank you, Dr. Bnar. And I think it's important to mention that if you do have those conditions, you're far more at risk from COVID than you are from the effects of the vaccine. So it's more important, if you do have those conditions, to have the vaccine rather than be scared because you may have a clot.
Absolutely. And also, sorry, Emaad, but just this is really important because COVID does increase your risk of clots by 200 folds. And these clots and COVID aren't just kind of normal, they are serious clots. People have died from these clots months after having COVID. So on balance, the vaccine is always, always safer. But if it means that you're worried about having the AstraZeneca vaccine, go and speak to your GP. They may be able to offer you a different one. But like I say, the risk of clots is so tiny and it just happens in a different way.
Thank you. Another question coming up. I've had COVID. Do I need the vaccine? If I can ask Dr. Bnar to come back in on this one.
Yes, so the answer is yes. And the reason for this is because we know that the majority of people who have COVID will develop something called antibodies, which is the protective cells that our immune system produces to protect you from COVID. But we also know from the data that not everyone who has COVID gets that defense. But the data for vaccination is much more robust. So we know that if you have the vaccine, you do get that protection. There's just no guarantee that you will have that protection after the COVID infection itself. And of course, then we do know people who've had COVID who've caught it again. So the answer and the advice is yes, you've had COVID, go ahead and have the vaccine.
Can I add something here as well, Emaad, to what Bnar said, which is very important. So even those who develop these antibodies, they disappeared from their blood a few months later. So contracting a COVID-19 doesn't give you like a permanent immunity against COVID-19 actually. So you'll get some autoantibodies, some antibodies, and that will fight COVID-19, but that will disappear months later. So it is very important that you get vaccinated and you get ready for the next wave of COVID-19 spread around in your community.
Absolutely.
Yeah, absolutely. Thank you very much. Next question is something that's quite topical and has come up in a lot of conversation in our GP practices, basically around pregnancy and breastfeeding. So can people who are pregnant and breastfeeding have the vaccine? Dr. Bnar, if you want to come in on this again?
Yep, so absolutely yes. So I'll take pregnancy first. We don't always routinely offer new treatments and vaccines and things for pregnant women in the UK, but in the US they do. So now we're offering the vaccines for pregnant women because we have really good data from the US of over 90,000 pregnant women who've had the Moderna and the Pfizer vaccines, and we know that they're safe in pregnancy. So we're now offering that routinely, just those two vaccines in the UK, because we're awaiting the data for the other vaccines. So if you're pregnant, you'll be offered it routinely and it's safe to have. Breastfeeding, also safe to have the COVID vaccines while breastfeeding. That will be whatever your age is. So if you're under the age of 40, you'll be offered Moderna or Pfizer. Over the age of 40, you can have any of the ones available on the ground. And what we know about breastfeeding is the content of the vaccine are not found in the breast milk, but the antibodies, the protective cells that the vaccine gives the mum to help her fight COVID, are found in the breast milk. So the babies who are breastfeeding will get the protection of the vaccine without even having had the vaccine. So both safe to have the vaccine.
Thank you very much. Next question. Again, this is something that's come up quite a lot of the time. It's quite a big concern for most people. Obviously, the vaccines come around very quickly. So some people think it's been, well, they've taken a bit of shortcuts. So the question basically is, has the vaccine been rushed? And if I can ask Prof. Kelechi to come on this one, please.
Thanks, Emaad. And I think you can understand why people would ask that question, because usually the process of developing vaccines and getting them through the phases of trials is usually a lengthy process. So this has been really quick, obviously in the context of a pandemic, but people would still ask, has it been rushed? And when people ask, has it been rushed? I think what they mean is it safe, or is it, and you know, is it really safe? Have they cut corners? The simple answer to that question is that the vaccines have not been rushed. Perhaps the better way to put the answer would be that the vaccines, the development and the process of trials for the vaccines have gone at a far quicker pace. And I'll give 7 very clear reasons why that has happened. So the first one is technology. For the vaccines that are based on mRNA technology, people go, well, the mRNA technology is relatively new. No, it isn't. The mRNA technology was developed first for, about nearly 2 decades ago in University of Pennsylvania. So it's been there for almost 2 decades. So the technology is not new. Scientists have a relative degree of experience around the technology on which those vaccine platforms are built. And the other thing about technology is that these technologies are better than previous technologies that underpin the production of vaccines. They've allowed the vaccine production to go quicker than would have been the normal length of time that other traditional vaccine technologies and platforms would allow. The second reason is that China very quickly got the genetic material, isolated the genetic material for this virus. And what that did was that it allowed scientists around the world who were working on COVID research to accelerate the process because of that. The third reason is the concept of an overlapping schedule. So normally when you're testing vaccines, having developed vaccines, there are clear stages that they would all follow. So the first stage, or what you call the preclinical stage, is you're asking the question of how will this vaccine work? And then you go on to your phase 1 or phase 2A and phase 2B, which then asks the question of what is the right dose and is it safe? And then your third step asks the question of is it effective? And then your fourth step is the regulatory approval step, where you end up with either a full approval or emergency authorization. I think it is important to get the message across that none of these steps have been sidestepped, if I may use those play of words. And the COVID vaccines have all gone through those steps. But instead of in previous times where they would happen in series, this time because of the emergency situation that we find ourselves in with a pandemic, they happened in parallel. Okay, so the concept of an overlapping schedule, I think, is an important one. The fourth reason is funding. Of course, we're in a pandemic, so governments around the world put in a lot of money into COVID vaccine research to get us to a place where we had effective vaccines. The fifth reason is study volunteers. Social media has played a significant role in encouraging people to volunteer for the vaccine trials, and lots of the vaccine trials have been able to get significant numbers of participants very quickly. Sixth reason is that COVID is quite contagious. So when you're doing research, you need participants to register for the trials. And because it is quite contagious, the infection passed very quickly, and we could get to the endpoints we were looking for very quickly in terms of are they effective in stopping transmissions. And I think the final reason is that companies bet on the vaccines working. So what happened was that while they were still going through phases, the companies just went into production. When you put all of those 7 reasons, and I'm sure there are more reasons, but those are just a few that I've given. When you put them all together, you can only come to the conclusion that they weren't rushed, but the process of developing and testing happened pretty quickly. But it is important to emphasize that they remain safe and they remain effective, and none of those necessary processes were sidestepped.
Thank you, Prof. That was very comprehensive, actually, and addressed a lot of concern that people do have. And sort of building on that, obviously some of the trials that we've seen, there's different numbers between how effective one vaccine is and how effective another vaccine is. So we'll pose that question to the panel. Is one vaccine more effective? And can you choose what vaccine you can have? If Dr. Mohammed Alhadj Ali comes in on that one, please.
So generally speaking, actually, all of them effective. And the vaccines went into clinical trials. So that was last year. And we had more than 100,000 people actually took part in these clinical trials, which were essential and key clinical trials before going to license of these vaccinations. So looking at the effectiveness there will be about a 50% protection from disease to get the license for that one. And all of them being very much effective in protecting disease of COVID-19. So I would say all of them effective here in protecting COVID-19. However, for people under the age of 40, we say that the option available for them will be Moderna and Pfizer vaccines. So I'm expecting, so the cohort attending us today, that they will be offered Moderna and Pfizer. As I said, I mean, effectiveness is something being very much observed in these clinical trials. And in addition now, we have data coming from like 1.5 billion people vaccinated around the world. And that will provide us with data for both effectiveness and safety. So I would say effectiveness is there, and there's no doubt about it at all. And all what we have to do is just be encouraged to get the vaccine and prevent ourselves and people around us as well.
And if I can just add something, the vaccine that's best for you is the one that's first offered to you. We all jumped to have whichever vaccine we were offered first, didn't question it, because we know the data is very good and very effective.
Exactly.
Yeah, thank you for that. Just a question that's come in on the Facebook, which is related to clinical trials. So I'm just going to ask this now because it does flow on to what we're talking about. So the question in from on the Facebook is, how can we possibly have long-term outcome data from vaccines in terms of side effects? There are many drugs to pass clinical trials which have been done over many years, and then serious side effects have been attributed to them, like cancer, and the drugs have been withdrawn. Given the vaccine rollout has been so quick, how can we possibly have the long-term data? So anyone want to come in on that?
Okay. Go on, Dr. Ali.
We can have both. We can have one and then Prof after.
Yeah. So, sorry, from my work as a clinical researcher with that one, I mean, talking about like a long-term like safety data and side effects. So we got a couple of points here. So first of all, I mean, talking about vaccines, we got like a history of vaccines and safety data available about that one, and that's been running for decades and decades. Now, with the current vaccines, as I said, I mean, we got robust data coming from 100,000 patients being in these key clinical trials, and that was last year. And we have now what we call it world evidence data coming from 1.5 billion vaccinated around the world as well. And we have registries, and we have a very accurate collection of data, and that will look at any side effects. Now, with these vaccines, they will be broken down in the bodies, and they will be out of our bodies within weeks. Within a few weeks, it will be out of our system. And if any side effects will happen, then in the vast majority, there will be mild side effects, and they are very temporary or transient side effects. So that means, in other words, so if they're going to happen, that will last for up to 48 hours, and then afterwards, they will disappear as well. And these very mild, and they do not require any hospital admission or any specific treatment, and we can cope with them. And that's exactly what we see with other vaccines, with the flu vaccines, which we used to take every year. Now, going to the next point, what's going to happen with those who've been in clinical trials. So there will be follow-up trials as well. And this is like a follow-up data collection for these patients who've been in the trials, and that will provide us with up-to-date safety data as well. And that will give us more reassurance about those who took part in the clinical trials. So that's in general how we can comment on the safety data from these vaccines.
Thank you very much, Dr. Mohammed.
Can I just add something, Emaad? I think that's a really good question that I get asked often, but I think what you have to remember is with vaccines, you take your 2 doses and then you're done. Whereas medications, you have to keep taking them so it stays in your body, so it keeps doing its job. And that's how we are worried, and we have to find out about long-term data for medications that you have to keep taking. But because the vaccine just 2 doses, within 2 weeks of having the vaccine, the contents, as Dr. Mohammed has said, are broken down, removed from the body. And we know, as he said, from decades of vaccine data and from this vaccine clinical trials that happened over a year ago, that side effects always present within the first few weeks. So that's why there isn't a worry.
And Prof. Kelechi, did you want to add anything else as well?
Yeah, I think Dr. Ali had covered it. Just one other thing, just to remind people that there are few other examples of vaccines around the world where we have globally vaccinated millions of people in so short a time. So when it comes to long-term safety data, oftentimes people think about duration, time. But the reason it is duration time is because for most vaccines, it takes time to get the number of data points being individuals who have received it. So, but in this case, we have vaccinated millions of people with these vaccines, and that's given us an incredible amount of data points to be able to confidently judge, make assessments of the safety and effectiveness of these vaccines. Having said that, it is important to also bear in mind that when I was answering the question earlier on the 4 steps, there was a last step that I didn't quite elucidate, and that's that last step that says ongoing monitoring. And hopefully it does give confidence to people to know that there's a rigorous process of ongoing monitoring and reporting of even the most minor side effects of these. And that's all being studied very carefully. So when you think about long-term, think more about the data points. And with these vaccines, we have built an incredible volume of data points in such a short time.
Thank you very much, everybody. Let's just wary of time, just going to move on to the next question. Will I still get COVID if I've had the vaccine? So Dr. Bnar, do you want to come in on this?
Great question. So these are probably the most effective vaccines that have ever been produced in terms of the efficacy out of the clinical trials, but also the data that we're getting in real world data. So people getting them on the ground and then data being collected, as Prof. Kelechi said. So your risk of catching COVID after the Moderna and Pfizer, because these are the ones that will be offered for those under the age of 40, your risk of catching it is incredibly low. The vaccines protect you and reduce your risk of catching the virus by about 94–95%. And those that do catch it have mild disease. So these vaccines pretty much eliminate severe disease and death from COVID. Now, there will be some people who might still end up in hospital with COVID, even if they've had the vaccine. That tends to be people who have weaker immune systems, who don't quite derive the full benefit of the vaccine. And that's why, even if we vaccinated the most vulnerable in society, we still need to vaccinate enough people to reach herd immunity, because there'll be some people who still need that indirect protection of herd immunity on top of the direct protection that they've already got from the vaccine.
Thank you, Dr. Bnar. The next question is, again, one of the very topical questions that we have, and we've been asked a lot by particularly women in this age group, and that is, do the vaccines cause infertility? So really important. I think we've seen across Wales that the highest hesitancy at the moment has been in women of this age group, and we think it's maybe due down to this question. So if I can ask Dr. Amara to come in just to answer that question, please.
Thank you, Dr. Emaad. As you rightly said, it is one of the major concern on the minds of youngster people when it comes to vaccine, and especially from people from certain background and cultures. Especially, I work with Asian communities, so most of the women, they are not worried about the side effects, but they're worried about if their daughters will get this vaccine, they will become infertile, and also the younger women, they're also worried about it. And in addition to women, not only women, but the men, younger men, they are also worried about it, that if they'll get vaccine, it will cause them infertility. So let me be very clear that no, these COVID-19 vaccines do not cause infertility. There is no scientific evidence whatsoever that these vaccines cause infertility. However, we have got scientific evidence and data that these vaccines have no effect on fertility, and there should be no concerns at all. First of all, the studies which were conducted in the laboratories in the animals have shown that these vaccines do not cause any harmful effect on fertility. Second of all, one of the main evidence is that initially when these trials were started with regards to COVID-19 vaccines, the volunteers, especially the women volunteers in the trials, they were asked not to become pregnant. Reason being because initially we didn't know how these vaccines are going to affect the pregnancy. Now we have got enough data and safety data with regards to COVID-19 vaccine and pregnancy, but at that time we didn't. So what happened that accidentally or unintentionally, some of the women, they did become pregnant. And what the scientists, they found out that the number of women who became pregnant in the group who were vaccinated was almost equal to the number of women who became pregnant in a non-vaccinated group, showing that these vaccines had no effect whatsoever in their ability to become pregnant. I think we need to know, understand how this myth originated. So basically what happened, that's the scientists that found out that one of the protein in this virus, the spike protein, has some similarities with one of the protein in placenta, which is a structure which attaches a baby to the womb of the mother. From this, people have started to assume that the antibodies which our body will make, if it is going to affect and attack that the spike protein or the protein of the virus, then most probably it will attack that the protein in the placenta, hence will cause either fertility issues or affect the pregnancy, or will cause or harm the baby, which is not true at all, because this is not the way how antibodies work. Antibodies work in a very precise fashion. It's like a key and a lock. So in order for key to open the lock, all the building blocks, everything should be in precise measurement. If there is any dissimilarity, the key won't be able to open the lock. So we can't say because there are some similarities, then the antibodies will affect the placenta protein as well, unless they're identical or similar in all of their building blocks. So this was the myth from which the people they assumed. The other thing we have seen that so far millions of people around the globe, they have been vaccinated. And we have seen even after vaccination, people are getting pregnant, women are getting pregnant, men are fathering babies. There are no issues whatsoever. Even in our medical circles, we have seen our own colleagues who have received both doses of vaccine. Our female colleagues are getting pregnant, our male colleagues are fathering baby, and they're going to have babies. So again, showing that there is no evidence that these vaccines can affect or can cause infertility.
Thank you,
Can
Dr.
I just add to that if I could, Emaad? Because I always get asked about fertility in the vaccines. No one asks me about COVID and fertility. Now, I don't know about COVID and female fertility. I don't know about the data there, but there is some evidence that COVID does impact and cause erectile dysfunction in men. So you have to always balance COVID with the vaccine. But Dr. Amara, you answered that beautifully. Thank you.
Yeah, I think that the male fertility is a big issue as well. And what Dr. Bnar is saying is really important. There has been data to show that COVID does affect male fertility. So if you're worried about fertility, then actually have the vaccine rather than not have the vaccine, because if you get COVID, it will affect it. We know that much for sure.
You've muted
Sorry,
yourself.
I think I've muted myself. So another long question we've had, and I think we've kind of gone through this actually, was about the long-term and medium-term side effects. I think we've covered that a little bit already. So I think we'll move on to the next one, which is again quite topical at the moment, and it's about the issue of vaccination in children. So will children be offered the vaccine? And by children we mean sort of under 18-year-olds. Dr. Bnar, what's happening with that at the moment?
Okay, so when we have data come back from clinical trials, the MHRA, which is the committee in the UK that decide what treatment and vaccine should be made available to the UK population, will look at that data and see if it's safe. So the Pfizer vaccine has been tested on ages 12 to 15-year-olds, about 3,000 participants, and it's been found to be safe in that age group and effective. So the MHRA, the UK authorities, have looked at the data and agreed that it's safe in that age group. We are now awaiting the vaccine experts to have a look at that data and see whether we should routinely be offering vaccines to that age group. The other ages are currently in clinical trials, so we're not going to discuss that today. But here's the thing. If we vaccinate enough people in the population, in the adult population, to achieve herd immunity, we might not even need to consider routinely vaccinating children, because we will have achieved herd immunity that way, and they will have then benefited from the indirect protection that herd immunity gives. So if you're worried about children being vaccinated and you're an adult, then consider if you have the vaccine, you're doing your bit to not even need to have that conversation about kids being vaccinated.
Yeah.
Does that answer your question?
Yeah, I think that answered very well. I thought there was a bit more you meant to say, but
no, sorry, that was it.
answered things very well. So I think coming on to one of the other questions we had sent in beforehand was if I have allergies, can I have the vaccine? So if I'm allergic to things, can I have the vaccine? There have been reports initially about a lot of people having allergic reactions to things. So yeah, Dr. Bnar, if you wanted to come in on this one, if people do have allergy to things, can they have any of the vaccines?
So initially the answer was if you had any allergies, then no, but now we've got lots of really good data. And if you are worried about a specific allergy, my advice to you is to go and discuss that with your GP, and they'll be able to go through your patient records, what your allergy is, and they'll be able to have a look and see what vaccine is safe and suitable for you to take. And if you are somebody who's allergic to lots of different things, but not to a specific ingredient to one of the vaccines that you can have, there are setups where you can have the vaccine in a center that is very well controlled, very, very safe environment. So if anything happens, we can intervene and keep you safe. So yes, you can still have the vaccine if you have allergies, but check with your GP.
And something that has come up, because some people who have had sort of reactions to their first dose have asked me if they can have a different vaccine for their second dose. And so that brings on nicely to the next question is, will I receive the same vaccine for both doses, or can I have a different vaccine from the first one second time round? Dr. Alhadj, can you enlighten us a bit on this particular question?
Yes, there are some data actually coming from clinical trials looking at combination of like vaccines or like mixture of vaccines, like first dose is different from second dose. However, our advice always, for people to stick to the same type of vaccination is being offered to you. So there's no need to change that one, because both of them will give you the maximum benefit expected from that one, and that will achieve the optimal benefit, as I said. There's no need to switch, and it happened before. When people asking about is this more effective than the previous one? Should I switch from type to another type, or should I go with this? This brand is better for me. I would say always stick to the advice being given to you. If the health authority or your doctor just offering you this type of vaccine, take the first one and then the second one. This is on a side. Secondly, as my colleague Bnar said, and this is clearly said, at the beginning there was some doubts about like people with allergy and getting vaccinations, but with the more data coming and from real world evidence, coming really from around the world, about like 1.5 billion vaccinations, no, people can go ahead with their vaccinations unless they have like a specific type of questions about allergy and they want to clarify that one with their doctors. But we would say carry on for the second dose if the first dose was given to you with no serious adverse events or serious allergic reaction, then just go ahead and take the second one.
Thank you, Dr. Alhadj. And on that sort of serious adverse event note, and I think we have covered this a little bit before, but because it's been in the news so much, I'm going to ask the question as it's come through about the clots and the vaccine. So can the vaccines cause blood clots? And Professor Kelechi, if I can ask you to take that one, please.
So over time, we have become clearer, and I suppose clarity is still increasing, particularly in respect of the risk factors for developing those clots. But I think it's fair to say that we've become clearer about a very clear association between having the AstraZeneca vaccine and developing of a particular kind of blood clotting that affects particular veins in the head. I'm not going to go into the full medical terminologies, but the increasingly peculiar thing about this kind of clotting is that it's clotting that is associated with a decrease in the number or amount of platelets, which is a bit unusual to have clotting with a decrease in the amount of platelets. So this is something that we have noticed, particularly with the AstraZeneca vaccine. It usually happens after the first dose rather than necessarily after the second dose. in terms of putting the risk in context, this is really, really important to describe this risk, because currently the risk of having that blood clots is somewhere in the region of 13 in every 1 million. Now, and then the risk of dying with that clot is somewhere in the region of 3 in every 1 million. Now, to put it in context, the risk of having an airplane crash into your sitting room and kill a person is about 4 in a million. So that this risk of dying from the AstraZeneca clots is smaller than the risk of having an airplane crash into an individual's room and kill them. So it is important to bear that risk in mind. But of course, with everything, it's always about risk balancing. And what we have found out is that we need to balance the risk of having these clots with actually the risk, as we have said earlier, that just catching COVID in itself is associated with some risk of clots, but also risk of mortality. So when it comes to the balancing of the risk of catching those clots and dying from those clots, that's got to be measured against the risk of dying from COVID in itself. So as you go down the age groups, then your balancing of that risk has to be very different. And that is why at this point, if you're under the age of 40, you're not you're being preferentially offered another vaccine than the AstraZeneca vaccine because of that risk balance. But I think it's important to always bear it in context. The risk is there, but it is a relatively small risk compared to certain other major events, including the risk of catching a clot from the COVID infection itself.
Thank you, Prof. And I think to bear in mind that, as you said, is lots of things that we give as GPs that is more riskier for you to have clots. So there's a lot of people who, for example, go on their holidays, want to delay their period. You have much higher risk of getting clot from something like that I give you, and people will beg me to have that, even though you describe the clots to them. But when it comes to the vaccine, well, no, I don't want to have that. But they're looking at the numbers. They don't really compare. So I think it's right. It's all about balancing that risk and benefit ratio. Something that else has come up quite a lot, really, and people do sort of bring this up. Are the vaccines experimental? I think this comes a lot from the US, where they've been given to this emergency license to be used. So, Dr. Bnar, can you come in on that and maybe shed some more light on where this has come from and why people think that these are experimental, or if that's true or not?
So I see this on social media a lot. I'm an old fogey, but I've learned how to use TikTok, so I can create some short video. My handle's there if anyone wants to have a look at my embarrassing videos, trying to explain the COVID vaccine, how they work, that they're safe, trying to reassure people. And I get this a lot. The vaccines are inexperimental until 2023. They're in trials, therefore they must be experimental. No. When we look at the safety and efficacy of any new treatment, they undergo phases 1 to 3 clinical trials. In 1 to 3 clinical trials, hello, just had little children join us. So when we have new treatments and new vaccines, they have to undergo clinical trials. And in phases 1 to 3 clinical trials, we look at their safety and efficacy. Every single vaccine that's approved for use and currently being used has completed phases 1 to 3 clinical trials. So the safety and efficacy, how effective they are, is no longer in question. The only thing we're trying to figure out now, and the reason that these participants are still in clinical trial, i.e. being followed up, is to ask the very important question of how long does immunity last? If after a few years their antibodies and their T cells, these protective cells within the immune system, are still circulating, we don't need to be worried about boosters. And if immunity wanes in certain age groups, we have to think about boosters in certain age groups versus others. But no, they are not experimental. They've been proven to be safe and effective. Phases 1 to 3 clinical trial is complete in all of them. So no, they've all been approved. They're all safe. I don't know what else I can do to say to people to reassure them. The publications are all there. It's a simple Google. You can read it. Anyone can access it. But it's still circulating on social media, and it's misinformation, and it's worrying people.
And Emaad, if I add something to what my colleague Bnar said, so as soon as the drug or the vaccine is licensed, I mean, this is now out of experimental phase. So it's now, in reality, it's in the market and it's available for people there, and they got licensed. So we're not talking about experimental phase or clinical research anymore.
It's illegal to make things available for use routinely if they were experimental. It's illegal. It's that simple. So they're not experimental. It just, yeah.
And sort of following on with something you said on that, Bnar, one of the questions we had in is, how long after the vaccine does the immunity last? So you've had the vaccine now, is that forever then, or do you have to have a yearly booster? How long does it last as far as we know?
Good question. So as I said, the participants in the clinical trial are still being followed up to see how long that immunity lasts. And so far, a year later, they're still immune. We're still seeing those circulatory protective immune cells against COVID. Now, the clinical trials were conducted in different age groups and with different people with underlying health problems, healthy people, people from different backgrounds. So it might be that certain people, particularly those who are slightly older, more elderly, might need booster shots, particularly in autumn, when we have the flu circulating and we might see another wave of COVID. That decision hasn't yet been made. So it might be that we need to do some booster shots in some people. It's been discussed that it might happen over those over the age of 50. And that's because their immune system won't be able to remember as well what COVID is, because just being older, the immune system isn't as strong, but also because we're still in an active pandemic. Might need a bit of a reminding. The other thing that decides whether we need to do booster shots is new variants. So at the moment, as Dr. Mohammed said, all the variants that are out there, the vaccines protect against all of them, but you have to have both doses to get that good protection and wait for 2 weeks after the second dose for your immune system to really benefit from it. But if a new variant was to come about that evaded the vaccine, we might have to update the vaccines to give us that good protection. That hasn't happened yet. And actually, the quicker we vaccinate, the less likely there is the risk for that to happen. So those are the things that will decide that. But so far, having 2 doses is enough.
And something else that came up a little bit earlier on when Dr. Amara was talking about the benefits of having the vaccine was the issue about long COVID. So for those of us who don't know what long COVID is, so what is long COVID? Who's at risk of having long COVID? And if I do have long COVID, can I still have the vaccine? I think Dr. Bnar, if you come in on that one, please.
Okay, thank you. So yes, so long COVID we're hearing more and more about, and there are over 1 million people in the UK, probably more, who have long COVID. So if you catch COVID, it can take up to 12 weeks for you to recover from the virus. And people who have persisting symptoms and feeling unwell and fatigue after 12 weeks, that's the cutoff where we say they have long COVID. In terms of who's actually affected, it tends to be people who had mild disease to begin with. We don't really fully understand why, but it's not the ones who had severe disease who ended up in hospital. It's those who had mild disease who managed it at home. They're the ones who tend to go on and develop long COVID. And it's also those who are middle-aged and younger people who are developing long COVID. Again, we don't understand why. So when we're talking about younger people, it's really long COVID you're more at risk of versus severe disease and hospitalization. But what is it? It's the hallmark of long COVID is fatigue that is so severe that people really struggle to return to work or university or school, because we have seen it in some adolescents. When I say fatigue, I'm talking about climbing a normal flight of stairs at home and having to pause a couple of times just to catch your breath. Symptoms include chest pain, shortness of breath, and various other symptoms. But we have seen other viruses cause fatigue after you've had the virus, but with long COVID, it's slightly different because we're also seeing evidence of irreversible organ damage. So scarring in the lungs, scarring in the heart, the kidney, the brain, the liver, and we don't fully understand why it is, but it is behaving differently to other viruses. In terms of the vaccines, the advice is if you do have long COVID, you can have the vaccine when your symptom is stable or unchanged for some time. But if you're still fluctuating and becoming better and worse, or particularly worse, then wait until your symptoms stabilize before you have the vaccine. And we are encouragingly having some evidence that those with long COVID do have their symptoms improve once they have their full vaccination. So that's very, very encouraging. But there's lots of clinical trials and lots of research going on to understand long COVID, because once we get out of this pandemic, that's going to be in addition to all the economic disruptions that we've had, long COVID is going to be one of the ones that we're going to be dealing with. And as a kidney doctor, I'm expecting to see lots of patients with kidney scarring just because they've caught COVID a few months or years before without and not necessarily have realized they've got kidney scarring.
Yeah, I think the issue of long COVID is something that we're going to see more and more of as we come toward, hopefully, out of the pandemic, and we see people who are going to experience these long symptoms. Just mindful of time, there's two final questions, both of them quite topical, especially at the age group that we're looking at. So the first one I want to ask is about menstrual cycles. So there have been some people saying that the vaccines will alter or change your menstrual cycles. So menstrual cycles means sort of the period cycles that young women have. Is there any truth to that? Anyone want to come in?
I'm happy to take this, Emaad, because I get this quite, I've come across this. So, okay, ladies, I'm talking to you now. If you have had any infection, the flu, the cold, any type of infection, you might have noticed that your periods have been slightly heavier or slightly lighter or slightly delayed, or you've had mid-cycle bleeding. That's very common in any infection, and you'll know that once you get over that infection, you're better, and then it doesn't happen again. Okay, so when you have a vaccine, you're essentially mimicking that infection, but without actually getting the infection, without actually getting ill with the infection. And the reason for that is because when you have your vaccine, you're telling your immune system what a virus is, so you can prepare your defenses against that virus. So for COVID, you have your vaccine, and if it happens to be that your vaccine is around the time that you would get your period, you might experience some disruption in your menstrual cycle with all the different things that I mentioned. But this is really important. It's temporary. It has no bearing on fertility. It's not long lasting at all. So really, really nothing to worry about.
Thank you, Dr. Bnar. And one thing that's certainly close to my heart is about travel. And so a lot of people want to go on holidays, want to go abroad. And the question is, do I still need to isolate if I go on a holiday after having both of my vaccines? So maybe a bit more, less medical, more political, but something that people do ask about holidays and things. So anybody want to come in on this question? Prof, I can see you're itching.
I'm not going to attempt to give very specific answer to that question, because the guidance is available, and what we should do is just refer people to the guidance on the Welsh government website. As you probably know, there's a conversation that is going on now about updating that guidance to reflect the vaccination status of people. But I think it is just wiser to refer people to the existing guidance rather than attempt to break down that guidance for people's specific situations during this webinar. That's what I would say, Emaad.
And Emaad, circumstances keep changing, actually, especially about the countries, the green zones, the amber zones, and all that stuff, and what you have to do afterwards. So the advice is always, just keep looking at any new rules coming on the system there.
Can I just add one point?
Yeah,
Not
yeah,
with regards to this question, but with regards to the previous question which Dr. Bnar has mentioned. I just want our viewers or listeners to understand one thing, that as Dr. Bnar said, that the menstrual changes which could happen because of COVID-19 vaccine or infection, these are usually temporarily. So if you have, if you're keep on seeing that the pattern of your periods has changed, or you're still suffering from irregular spotting or bleeding, please take the advice of your GP. Please contact your GP. Don't just assume that it is because of the vaccine or the infection. It's really important that you take your GP's advice and go and seek the specialist advice.
Yeah, and that's a very good point, because the reason it won't be the vaccine, because we know the vaccine doesn't do that. So if there is a persistent change, you need to get checked out to make sure it's not something else. Thank you, Dr. Amara.
One thing just to add from my own personal practice is what you may find is you become unwell due to a side effect of vaccine, but it's actually just exacerbating an underlying health condition that you may already have had that you didn't know about. So we've had patients who've come in because they had a side effect. We've done some tests, and it actually turns out they have an underlying health condition that they weren't aware about, that this vaccine is just sort of exacerbated and shown up. So it's not always just the vaccine that's causing it. There are some other things that may be lying there. So if you do have these side effects, important to go to the GP, get all the relevant tests done to make sure that everything's fine and it's not just a side effect. I just want to add one more thing about the travel side of things as well. I think it's important to realize not just the rules and regulations that the UK government have got, but also the other country that you're visiting have as well, because there's two sets of people who are going to dictate how or what you need to travel. So even though, for example, Iceland is on the green list for the UK, they're not accepting people from the UK unless you have to go there and you've had your 2 vaccines. So important to check both sides of things before you travel. And as the panel mentioned before, that's ever changing. So you may go somewhere which is on the green list, it can change to another list, and the situation will change completely. So just have a think about things and see if you really need to travel at this time. One day we will be able to travel again, but maybe just wait a little bit longer until things are a bit more clearer. Fine. I think that's all the questions we've had. I posted the travel guidance at the moment for Wales in the Facebook chat there. So if you do want to have a look at that, please feel free. But I think that's everything we've had done. So I want to thank everyone from the panel for taking your time out to answer the questions, and thank everybody in the audience for coming in to listen and asking the questions that you've got concerns about. I'm just going to quickly go around and ask the panel if you wouldn't mind just giving us a few closing statements, if we can keep it brief, just because I think some people have got other commitments after this. So we'll start on my screen, who I've got next to me, Dr. Bnar. You just give a brief closing statement, and we'll just go around quickly and then end the session.
Thank you very much, Emaad, and thank you to all of the panel for taking the time. So I'm 32. I consider myself to be young. I don't have any underlying health conditions. And being a doctor and scientist, I'm fortunate enough that I can understand the data and be able to interpret the science. I didn't hesitate 1 second to have my vaccine. The advice I've given my family is to have all their vaccines they all have, except for my daughter who's too young. And I think it's okay to be worried and concerned, because there is so much misinformation out there. I don't blame people for being worried about these vaccines, but please reach out, please have a dialogue with us, please go to your GP. That's what they're there for. They've been doing a fantastic job in this pandemic. And then also there are people on social media. So I've got a profile, I'm pointing the wrong direction, there we go. On TikTok and Instagram, Team Halo Guides, there are 60 of us around the world. We are happy to be contacted. Please reach out and make sure you're getting your information from accurate sources, people who can back up what they're saying with real scientific evidence. And yes, good luck and stay safe.
Thank you, Dr. Bnar. Dr. Amara?
I'm not going to disclose my age as Dr. Bnar. I'm much older than Dr. Bnar.
Don't look it if that makes you feel better, Dr. Amara.
But yes, I've had my 2 vaccines, and I'm really, really happy. My son, if he was of the age that now we are offering the vaccine to, I would have taken him to have the vaccine. He's not entitled to have vaccine yet. But the reason I'm saying is that we are not just seeing this, we have taken the vaccine ourselves as well, and we can assure you that there's nothing to worry about. We can understand that if you have got any concerns, as Dr. Bnar and other panelists have said, that please seek out, please reach out and ask your GP or the government resources, and take the good advice from those resources, rather than going on the social media and just listening to one another. It's always important to seek advice from the people who have got the right knowledge.
Thank you, Dr. Amara. Prof. Kelechi?
Yes, thanks. I mean, I think it's been a fantastic session. I've enjoyed being a part of the panel, as well as listening to the other panelists. I think the thing to say is that ultimately, as individuals, we will all make our decisions, and no one is going to put a gun to somebody's head and get them to get vaccinated. This is all about providing you with the information that you need to make the right decision. I do hope that that decision will be to take the vaccine, but ultimately this is about giving you the right information. And I hope you do feel that you have had additional helpful, useful information to help you decide that the right thing to do is to get vaccinated.
Thank you. And Dr. Alhadj Ali.
I contracted COVID back in November, actually, and then my wife and my child as well, they got it. We had very difficult time. We have a very tough time as a family. We survived from COVID. We had some long-term COVID as well afterwards. A few weeks later, after we had and contracted COVID, the vaccine was available. And I wish the vaccine was available before we contracted COVID, actually, to prevent us from experiencing what we had back in November, early December as well. So we provided information, as Prof said, and I encourage people sincerely here to take the vaccine. We can see now the light at the end of the tunnel. However, we need to speed up the process of getting out of this tunnel now by getting the vaccine, getting herd immunity for our community, protect and prevent this society, this lovely community, from COVID-19, and speed up the process of getting back to normality. I would say stay safe, commit to social distancing, and get your vaccinations, get the couple of doses if you can, if you're happy with the information we provided to you today. And let's all hope that by end of this year, we're gonna see a beautiful end of journey with this pandemic.
Well, thank you everybody for those, and thank you, Dr. Alhadj, for sharing that experience with your family. I think people forget the personal stories behind what we do and the personal stories that are behind the numbers as well, and it has devastated a lot of people. And I think vaccines are one of the ways out of it. And hopefully this webinar will have given you some information to base a decision on, where you can make the right decision, which is for yourself, and go and find the information that is credible and reliable. And if you wanted to find out more information, please follow us on social media, on Twitter, Facebook, and on Instagram, Muslim Doctors Cymru. And also, as Dr. Bnar has mentioned, Team Halo as well, produce some fantastic content, fantastic videos. So please have a look at their content as well. And just make sure you're getting the information from people who know what they're talking about, rather than people who have twisted information and misinterpreted it. So once again, I want to thank the panel for their time, and thank you all for listening. We hope this has been beneficial. We're going to pop this onto YouTube as well if you have missed it, or you know anyone else who wants to listen to it. So please pop onto YouTube and you can see it again. If anyone does have any other questions, please feel free to contact us via social media, or drop us an email at muslimdoctorscymru@gmail.com. So without further ado, thank you everyone, and have a good evening, and keep safe.